everybody. Welcome to Health Check. I'm Julie Cook Downing, in for wonderful Heidi Godman. And do we have a great show lined up for you today? We're going to be talking all about something so many people are coping with right now, especially our veterans, and that's PTSD. We'll speak with a veteran who's been dealing with PTSD in our second half, but we are going to start out today by finding out more about PTSD from an expert. And for that, we're going to be turning to Dr. George Lindenfeld. And I want to tell you a little something about Dr. Lindenfeld, but before I do that, welcome to the program.
Thank you. It's a pleasure to be here.
Now, George Lindenfeld, PhD, is a clinical psychologist, a current author, research, and founder of the Reset Therapy Professional Institute, which focuses on the training and certification of those in the healing professions. There is so much more background that I could give you about him, but if we took the time to do that, we wouldn't learn as much as we will about PTSD. So, I'd like to start off by asking Dr. Lindenfeld exactly what is PTSD.
Well, let's start by dropping the D part. Our veterans get a little irritated when they hear this as a disorder. And I'm going to quick take you back to evolution, because what I'm telling you, Julie, is that we are not designed to deal with things that could eat us up, beat us up, or hurt us. The word for that is trauma. And when that befalls us, something in our brain changes the circuitry to keep us from having to go through that again, such as smelling the tiger's breath. You don't want to do that twice.
No.
But we don't have a switch to turn it back to the way it was before. So evolution has preset us to react in a different way when a triggering event is similar or like the original trauma. That's what PTS is.
Wow. Now, I'd like to know and have our audience know why you are so interested in PTS.
Oh, my goodness. All right, I'm going to tell you a little personal story.
Please.
I don't do this often now.
Okay. There are only a few listening. Ha, ha, ha.
I was a little guy, about 5, and I'd asked my grandpa, who came to this country from Austria-Hungary, about his family. I understood he had brothers and sisters, and his face would turn pale, and he would walk away. And I couldn't figure out, how come Grandpa can't tell me? Later, I learned that he lost his entire family in Auschwitz. He had PTSD. I have been, I guess, drawn to this all of my life.
Wow. That's very special. And when you have a personal story like that, it certainly does bring passion, doesn't it?
That's what I'm all about. And this is my mission, to end the nightmare of PTSD.
All right. Can you give us some idea about the prevalence of PTSD?
Oh, my goodness. It's kind of hard to come by, but we can estimate maybe 15, 20% of our combat veterans are walking around with symptoms of that disorder. I will also guesstimate, by the way, that our first responders have the same rate.
Wow.
Our firemen, our policemen, our emergency room nurses.
And you know, we so frequently think of PTSD with veterans only. You've opened up a whole new branch of thinking.
Well, let me take you another step. Abused women, abused children, and on. Violence between partners. This is not just limited to those who go to war.
When we're talking about those who have not gone to war, because we pretty much know how they behave if we're living with a loved one with PTSD. But with these others that are outside of being veterans, what are some of the things that we see that happen?
Well, with children, their brain does not develop normatively. They have much more difficulty learning. They have tremendous difficulty bonding with battered women. Scratch your head and ask, how come they keep going back to the same kind of person? And the reason is the PTS. Trauma changes the nature of the brain.
My goodness. I remember a couple of years ago, I did a lunch and learn for wounded warriors and their caregivers. And what I learned about the actions of those having PTSD absolutely stunned me. I could not believe that it almost became as though they were not humans. And in fact, some of the people living with a PTSD person were given cards that they would hand out in public places to explain why their loved one was behaving so differently from the norm.
Perhaps I can help you with that a little bit. When the switch is turned on, the fear anger switch, the person goes into fight, flight, or freeze and is stuck there. Something goes off in a theater and they dive on the floor because they think it's incoming time. The whole brain system is altered. And research is telling us that this is not just emotional. I'm going to tell you, Julie, that combat vets are developing dementia at twice the rate of non-combat vets. Twice the rate.
Oh,
It's a systemic problem, a health problem, an emotional problem, a relationship problem.
wow. This is so very heavy. I'm wondering how someone knows when they're with someone with PTSD, but it has not been diagnosed. What are some of the things that they should look out for in terms of symptoms?
The two most prevalent ones I'll begin with are insomnia and nightmare/flashbacks. Now, I want to talk about treatment real quick because if treatment doesn't remove those two in particular, it is not successful. It's a failure.
Wow. And just, all I can do is think about that kind of a failure. There's some kinds of failures where you can get up and say, I'm going over and trying again. But a failure on PTSD is so just beyond demanding.
Well, unfortunately, what our veterans and first responders and civilians are told that this is a lifetime condition. Can't rid yourself of it. You can take pills. Maybe you ought to be in therapy forever. This is what it is. And it's just not true.
Wow. Well, one of the things that I'm so happy about and will be mentioning throughout this entire segment is that the group that I do monthly for veterans caregivers and for veterans when it's appropriate is happening on January 16th. And I am so proud and pleased to let the audience know that it's Dr. George Lindenfeld that will be the guest speaker for that event. It will be happening at Datoli Cancer Center's Education Center on January 16th, and you can register for very easily sending an email to me, caregivercomfort@aol.com. So just know that you are hearing now from the expert who's going to be personally available to you on January 16th from 12:30 to 2. And we'll get into more depth about that as well. Because we are getting ready to come to an end of this segment, And we're going to take a quick break. When we come back, we're going to talk more about PTSD. This is Health Check on WSRQ. Welcome back to Health Check. I'm Julie Cook Downing, in for the wonderful Heidi Godman, and I am so privileged to have as my guest Dr. George Lindenfeld, who is a PhD as a clinical psychologist, current author, researcher, and founder of the Reset Therapy Professional Institute, which focuses on the training and certification of those in the healing professions. We've been talking about PTSD, and we're going to go further into that subject by talking more about his medical area in terms of diagnosis. How is this PTSD diagnosed, Dr. Lindenfeld?
Well, normally it's a list of symptoms, and there is an interview typically conducted with a licensed person, and one checks off from that list. And if you meet the criteria in this book called DSM-5, it's a psychiatric diagnostic book, you got it. But I'm not so much concerned about whether it meets the paper criteria or not, because most of the veterans that I come upon have already had that diagnosis through the VA or another doctor. What my focus is of helping them rid themselves of those symptoms.
Okay, thank you. I'm going to do just a tiny bit of diversion because you mentioned a book, and I'd like our audience to know that Dr. Lindenfeld is the author of 5 books, and I'm going to give you the title of one of them that I think is just outstanding and astounding. It's entitled Ending the Nightmare of PTSD, a revolutionary approach based on new brain science. And as a result of me reading that, I'd like to ask Dr. Lindenfeld what some of the traditional treatments have been for PTSD.
They're called gold standard. It means they've met the rigor of scientific research, typically in laboratories, universities, also clinical settings. Unfortunately, meta-analysis, that means you take a whole bunch of these studies and you put them through rigorous tests, are telling us they're not doing what they were cracked out to do. In fact, of these gold standard tests, perhaps a third show some remission from the effects of trauma, but I don't know of any that totally release from those 2 I mentioned, insomnia and nightmares. Folks continue to have that.
Wow. So there are some alternative treatments, and as I get to know you better and read more and more about you, I know that you have an alternative treatment.
Now we're talking up my alley, Julie.
Okay. All righty.
So I'll chat about that a little bit. If evolution doesn't give us the switch to flip off the fear-anger circuit in the brain, we have to find one. We've got one. Now, there are a few. Some use light, some use eye movement, back and forth, called EMDR. Reset therapy uses sound, and I'm going to quick walk you through that.
Okay.
That trauma, which I'm going to call a target from now on, has a frequency in the brain. And if we can find a way to tune into that frequency with a matching sound, then we can alter it from being restored in the brain. I don't want to get too technical here, but PTSD trauma is a memory problem. It's not that it happened, it's that we can't stop forgetting it. If we can change that, then the emotional part drops out and the person is free of the emotional trauma. They'll remember everything, even more. But the trauma effects are gone. we can tune the sound, I call it the healing sound, into that target. And after 5 to maybe upwards of 15 minutes, it's gone, Julie.
Wow. Um, if I remember correctly, you have a trial that you accept volunteers to do. Is that correct?
Well, we are conducting an approved study, through a human research committee that said this is good to go, of 36 combat veterans in the greater Sarasota area. We want 12 from Vietnam. We're looking for 12 from Desert Storm era, and we're looking for 12 from the Iraq, Afghanistan. And we are going to put them through testing, and they're going to get their brains mapped. We actually map the EEG, which becomes activated when you have a trauma and quiets down when it's gone. And they will receive 2 to 4 treatments. That's all I believe it takes to free them from this trauma.
Wow.
Then they're coming back. They're going to get post-testing. They're going to get another brain map, and they're going to come back at 3 months, and they're going to come back at 12 months.
I'd like to give out your email address. So for those that could be in the category of being able to be a volunteer. And Dr. Lindenfeld's email address is G as in George, L as in Larry, I as in Ida, N as in Nellie, D as in David, Y as in you, 123@gmail.com. I would love for those who are in the 3 categories for the trial to contact Dr. Lindenfeld saying, I'm interested. And then on January 16th, at the event that I mentioned in the first segment, you would be able to meet him personally and hear him speak even more fully about his reset therapy and PTSD. But that's glindy123@gmail.com. So we have the treatment. We have the alternative treatment. What's the prognosis as you have experienced and as you know with your treatment?
Well, I've got 100%, Julie. So the prognosis is pretty good.
Wow.
Now, I've trained 6 therapists, 1 from Tampa and 5 here in Sarasota. And last count, they've seen over 93 people. 3 people dropped out because they simply didn't like the sound. They didn't even want to give it a try. 90% have made progress in whatever the focus was. And mind you, this is just not veterans. These are people with anxiety. These are people that experienced a traumatic insult of some kind. Car accident. Doesn't have to be by another person. I think we've got a pretty outstanding batting average at this point.
Well, I think we're going to even learn more about that in our 3rd and 4th segments of this program, because we're going to have a guest who has been through reset therapy and will be able to give us his perspective on the treatment. So we've got a lot to look forward to as we're moving forward in this particular program. Let me ask you this, Dr. Lindenfeld. What about the complications? Let's say that you get a treatment that doesn't work and you have PTSD. What are the resulting complications?
I don't know of any resulting complications. What that means to me is that it hasn't been tuned in appropriately to the neuronal circuitry that's fired up due to the trauma.
Wow. How do you get people to recognize that they have an anxiety problem?
Usually significant others will bring that rapidly to their attention.
Okay. Now, I have to ask, how do you discern, like, I've been married for 46 years and have a wonderful husband, but sometimes I feel anxiety just because of being married and the fact that there are things that go on in households that can make you a little anxious. So how do you put your fingers on this severe PTSD and someone saying, oh, I've got anxiety, I need to be treated?
Well, I think you're going to hear from our next speaker as to how one can differentiate. But for me, it's the extremity of it.
Okay.
By the way, reset therapy is used not just in trauma. My third book is on comorbid conditions, including depression, addiction, chronic pain, and on and on and on. Survivor's guilt, unresolved grief. This is a treatment that breaks up circuit patterns in the brain that go on and on and on. And when those patterns are broken, learning, interest, excitement, growth come in their place.
You are so full of passion about what you do and so far outreaching to help those that need help. I'm just overwhelmed with what you have done and what the future can hold for those who have not been through reset therapy to date. We're going to take a quick break. When we come back, we'll talk with our guest, Dan. This is Health Check on WSRQ. We will be right back, and I can't wait to welcome our upcoming guest, Dan, with Dr. George Lindenfeld. Welcome back to Health Check. I'm Julie Cook Downing, in for the astounding Heidi Godman. And I have two guests now, Dr. George Lindenfeld, who's spoken for the first two segments, and I am pleased to introduce Dan, who has joined these last two segments. I want to honor Dan for his service to our country. Just to give you a little background, he's had 4 tours in Vietnam and has had PTSD symptoms for 50 to 55 years. I am so excited for him to tell you his story of PTSD and talk about the reset therapy sessions that he's had and how he feels about them. So first, I'm going to ask him what it was like to have PTSD.
Well, first, thanks for having me. I appreciate the invitation. And perhaps it'd be best if I just give you a little background on myself.
Please.
So I did, as you said, 4 tours in Vietnam. 2 of them was as a special forces medic on an A-team in Vietnam. And 2 of them was flying aircraft in Vietnam. So 4 total tours. So I was very interested to hear about the first responders because I had both ends of that with the being a special forces medic and doing the medical trauma in Vietnam. So as you could probably imagine, over those 4 tours, a lot of things happened, and I won't go into what happened, but certainly I did suffer from PTSD. And it was just the normal symptoms, and we can discuss that.
Yeah, please. When you say just the normal symptoms.
Well, a lot of things happen. You have anger issues, you have sadness issues, you have denial issues, if you will. You have a fear of intimacy. You react strangely to loud noises, the old duck under the table type thing when a car backfires. Bad dreams, waking up, throwing your fists and kicking and so on and so forth. You can imagine how well that went over with spouses.
I was going to ask you, are you married?
I've gone through 3 of them.
Okay. All right, Dan.
And I think that was part of it. I wasn't probably the most pleasant person to be around, but I'm a very content person right now.
Mm, mm, mm. Did you know other people with PTSD that were sort of your buddies?
I did. Old Army buddies, but I didn't stay much in contact. I will tell you there's something that we haven't really discussed very much.
Mm-hmm.
There's a trend, and this is especially true with Vietnam vets. I had a very successful career, both while I was in the Army and also post service. But the symptoms really set in strong after retirement. And what happens is all of a sudden, you're really, really busy and you're really occupied and you're really trying to uh, accomplish things. And all of a sudden, that day stops and all the bad things start coming back, and it comes back uh, tenfold.
Mm, mm, mm. Before being involved with PTSD, were there other situations that you could compare to having PTSD or even come close to it?
Uh, well, you have to understand, I joined the Army when I was 17 years old. So,
Ah,
and it was at 18 when I had my first experience in Vietnam. So I was a kid the entire time, and that's been some 53, 54 years past. So I only remember just being a young, happy kid, and all of a sudden, I wasn't a young, happy kid anymore. I was forced into being a grown up.
how did that feel?
It was strange because all of a sudden you go from being out playing baseball and trying to get a date on a Friday night to all of a sudden you're in the midst of combat and taking care of wounded people and with traumatic wounds, and uh, knowing that your life or what you do, the decisions you make, will impact their lives. I, in fact, at the age of 19 years old, had my own hospital with the Montagnards, Coho tribe. I delivered 25 babies. I
Wow.
I pulled one of my favorite stories is I actually uh, went in with an elderly gentleman who had a bad tooth, but his teeth were so tarted together. When I pulled his teeth, all of the top row of his teeth all came out. So uh, we were we were kind of on our own, and I was the only medical resource that Montagnard tribe had.
Mm, mm, mm. Now, learning that you have had 50 to 55 years of PTSD, what did you try to do to get it treated during that time period?
Well, I really didn't recognize that I had PTSD until some years after I was retired. And I approached the VA, and I went to the VA, and they put me through. They did the testing and said, yes, in fact, you have PTSD. And they put me through a cognitive processing therapy, which was 12 weeks of analyzing it, reliving the trauma, and then getting you to try and rationalize how it went or why it wasn't really why it shouldn't affect you.
Hmm.
Suffice it to say, it didn't work. It the nightmares were still there, the kicking was still there, the temper was still there, the anger was still there. And there's something. When I was referred, and I was referred by Dr. Harvey to Dr. Lindenfeld to Dr. Fred Harvey,
Uh-huh.
and that's a plug, doc. Uh,
Hey, and I happen to know him. Nice plug.
yeah. So at any rate, Dr. Lindenfeld did as he said, the brain mapping, and then we went in and identified some major triggers, and then he did the audio on me. And lo and behold, after the first session, I said, wow, something's changed. It really, really worked. And I went back and I said, I don't think we got it all. And he says, well, we need another session. And we went back in and we went through a lot of things, and we got some more. But you have to remember, after 4 different tours, that I probably had a couple of triggers. Probably in my case, it was 5 or 6 triggers. And the last session, which took a good 20 or 30 minutes, I think we got it all. And I walked out of there, and uh, I have not had a bad dream since. I have not had any anger issues. And there's one other thing that I come to realize, and this is why I'm going to tell you that I'm here. There's a case, or there's a symptom that most combat veterans would be ashamed to say that they had PTSD because they feel like it's a weakness. And I came to realize that no, this wasn't a weakness. It was actually an issue. And that's why I'm here today, because I want every combat veteran out there to come forward and let's get it taken care of.
You know, I'm delighted that Dr. Lindenfeld had you come on the program today. And just with what you're saying, I know that on the January 16th event at Datoli Cancer Center, where it's a free lunch and learn from 12:30 to 2 for veterans, veterans caregivers, and veterans serving veterans, where Dr. Lindenfeld is going to be the guest speaker and talking about ending the nightmare of PTSD. They will also have a chance to meet you in person along with the wonderful Dr. Lindenfeld. So for those of you listening that want to end the nightmare of PTSD, learn more about it, and learn more about this therapy, send me an email to register, caregivercomfort@aol.com. This is a free lunch and learn for the veteran community. You're hearing Dan today telling his story. You've heard Dr. George Lindenfeld talking about his expertise and his passion. And when we do the second of our last 4 segments, we're going to have both Dr. Lindenfeld and Dan speak. So we're going to take a quick break, and when we come back, we will have both experts talk, because Dr. Lindenfeld's the expert on PTSD. Dan is the expert on having had reset therapy that has worked and has released him from PTSD for the last 55 years. I am delighted and excited to have both of you here with me. Welcome back to Health Check. I'm Julie Cook Downing, in for the fabulous Heidi Godman. And I have 2 guests with me, Dr. George Lindenfeld, a clinical psychologist who has a specialized treatment for PTSD and a passion for PTSD. And I have Dan, who has had PTSD for 55 years. And we're bringing Dan and Dr. George Lindenfeld together because Dr. Lindenfeld is responsible for Dan no longer having PTSD. Take the floor, gentlemen.
Well, Julie, let's start off with a statistical fact. 20 veterans are committing suicide daily. This has to stop. We have a way to stop it. This is a network in the brain that can be switched, can be brought back to normal. We got to do it.
And one way you're doing it is with these trials needing volunteers. Would you reiterate for us, please, the groups of veterans that you are looking for?
Yes, there are 3 groups, total of 36, combat veterans with PTSD in the greater Sarasota area. We'd like 12 from Vietnam, 12 from the Desert Storm period, and 12 from our fairly recent Iraq, Afghanistan.
And you can reach Dr. Lindenfeld through his email address, which is glindy, Lindy, 123 @gmail.com. If you're interested, you can also meet Dr. George Lindenfeld at the Lunch and Learn that I sponsor and facilitate on January 16th at Datoli Cancer Center, and you can send me an email to register for that at caregivercomfort.com. I would also like those that are listening to know that the Sarasota County Veterans Commission is sponsoring the lunch for the Lunch and Learn January 16th. Let's have Dan and Dr. Lindenfeld talk together.
Sure.
Well, first of all, I want to encourage everyone that has had to deal with this PTSD to please come to the Lunch and Learn on the 16th, and I'd be glad to meet you. And if you'd like to talk to me, you can get in touch with me through Dr. Lindenfeld, and I'll be glad to sit down and talk to you and tell you what the experience has been. Trust me, it's going to be well worth your time. It's going to change your life.
How is this treatment different, Dan, than the talk stuff that you've had?
Well, the talk stuff is basically coming up with some type of rationalization that it wasn't your fault and you should put it out of your head and those type of things. It really doesn't do anything except bring out poison and make it worse, in my opinion. At least that's the way it was for me.
So you were asked when we were doing the treatment to light up the brain. What did that mean to you?
It's funny because Doc, as you know, you said, I don't want you to poison the atmosphere. I just want you to go through and think about the triggers, if you will. And the triggers are the things that the trauma that took place. And when you light up the brain, you think about those traumas. And when you did that, or when I did that, you could feel all the emotions come to the top. And what was so neat is when you went to the second part of it, when you actually put the audio on and lit it up again, the audio just kind of made it all fade away. It was spectacular.
So there were two steps to this. One, you were asked to light it up so that the sound could be tuned in, and I'm going to use the fancy word resonate, or connect with the frequency of the trauma. And then a second sound was tuned in, which weakened it, dissipated it, made it fade. Correct?
Exactly, yeah. You used technical terms. I'll just tell you, you made it all better.
I got to use technical terms. It comes with the license, Dan.
I hear you.
He's a techie, Dan.
Yep. Well, I'm going to equate this because, well, I've been in practice 45 years, mind you.
Wow,
I'm
again.
77 now. And I did the talk therapy with people, frustrated. Maybe there's something wrong with them. Maybe there's something wrong with me. Now I've come to understand that the analogy here is I'm standing in front of the light switch and I'm hollering at it, turn off. Turn off. That switch isn't going to turn off. But when we get the sound right, connected to the target, it turns it off. The brain wants to rid the poison. I'm going to explain the poison. Can you explain it, Dan?
Well, the poison is if you go back and you review that trauma, whichever trauma is bothering you, and it comes out. It's like poisoning the entire room if you bring it out verbally. And when he finds it and he tunes it in and he puts the audio on it, it just goes into a total fade out. I'm going to tell you one other thing real quick, Doc. Your passion is contagious, and I now have that passion.
Oh, man.
So I'm here to help.
I know
anything that I can do. I'll be there for you.
Tell
Wow.
them about your graduation test.
So after we took the last trigger out, the doc said, "I need you to do something. I want you to. This is the test. Go see the Vietnam movie, We Were Soldiers." And I'll tell you, there's an avoidance there. I hadn't been to see a war movie in 50 years, not one. And I went and I enjoyed the movie, We Were Soldiers. And I followed it up the next night with another test, and that was Hacksaw Ridge, and that was a combat medic, conscientious objector in World War II, and it was a gory movie. I didn't enjoy that movie as much as I enjoyed We Were Soldiers, but I'll tell you, I passed the test.
Yes, you did.
And I'm trying to not have my mouth just drop as far as it could hearing these successes with you. I am just flabbergasted, and I am feeling so excited about the fact that Dr. Lindenfeld has agreed to be the guest speaker at the January 16th event. Registration is free. Lunch is free. Caregivercomfort@AOL.com. I also have a phone number, 941-360-3580. That's Julie Cook Downing, and my business as Caregivers Comfort Creations that has come up with having events like this monthly for the veteran community. The two of you, again, I know you said you were referred by Dr. Fred Harvey. What was it like meeting the first time?
I was very skeptical. I said, come on, we're going to do this, and after 55 years, you're just going to make this go away in a couple of sessions? I said, I don't think so.
Now, I asked Dan to stay skeptical because guys like Dan have been fed so much BS, they can't even trust themselves. So one has to experience this to be able to become the advocate. And today, Dan proclaims that he is one.
Well, I am in person with Dan, and I know that he is being as truthful as possible because we have an audience that is hanging on to every word that's being said here. This is revolutionary. This is just so special coming to Paradise, Sarasota. I mean, what else could we ask for our veteran community and our first responder community other than recognizing that they have PTSD and have a way of getting rid of it and learning more about it? Because you can't go into any kind of treatment without having some background and a firm understanding. And with Dr. Lindenfeld's expertise and work over the years with a passion for PTSD, we know that there is not going to be a misled situation.
No way.
You can promise that.
Absolutely.
Well, we are coming to a close. I am honored and privileged to have had Dr. George Lindenfeld, the expert with PTSD, and Dan, his advocate, here. I want you to be able to meet them both January 16th. Lunch and Learn for the veteran community. Email me, caregivercomfort@aol.com. Call 941-360-3580. This is free. And bless all of you.